Our next presenters tonight are here to provide us more information on suicidal ideation in children and youth. Dr. Sharon Horlick, psychologist at Maryville, and Charysse Pawley, the manager of clinic services at WRCC.
We're going to talk to you a little bit more about suicidal ideation, risk factors, that kind of thing. But as a backdrop, I just wanted to say a little bit about the stage of life that we call adolescence. And I want you to think about a few of the next few slides in terms of a backdrop and information that you can think about whether you're concerned about suicidal ideation or not with your kids. But this is something that can apply in general to anybody who is parenting when their kids are in the stage of adolescence. So adolescence is a stage of development, and it's a long stage of development. You say maybe from 11, 12 up to through the teens, and maybe even into the early 20s would comprise the stage of adolescence. And in every developmental stage, there's a task or something that has to be accomplished. And in adolescence, the task is separation or individuation. So the idea is by the time you get through adolescence, you should be able to function independently and establish your own identity. That would be the outcome if you're getting through adolescence in a healthy way. And as a result, one of the things that adolescents are going to do is then try out different roles and different identities as part of coming to understand and find out who they are and what they're going to be. And sometimes that means that people feel like they may have an alien in their house at different stages during adolescence, but that's all like healthy and normal. So it's just something good to know, so you've got some perspective. And because the task is to separate and become your own person, autonomy from the family is increasing during adolescence, and also peer influence and a desire for peer acceptance, those kind of things are pretty significant. And the youth are then more susceptible to stressors related to peers. So you may find that there's a lot of new issues having to do with body image, things to do with social media and the whole kind of social networking thing. Other stressors can be, access to drugs, alcohol, stuff like that, things that you wouldn't have had to contend with maybe when kids were at a younger stage. So that's one thing to keep in mind. Another point you want to keep in mind is information that we know about the adolescent brain. And what we know now from research is that the brain is still developing in adolescence. And it has not yet reached full capacity for things like interpreting emotional cues, for problem solving, and for anticipating consequences. The final part of the brain to mature is the frontal lobe, which is kind of right there. And that is the part of the brain that's responsible for things like decision making, controlling impulses, delaying gratification, and weighing consequences to make rational decisions. So that's the part of the brain that would say, well, I better take out that garbage and do my homework and, so forth and so on. And then, I'll call so-and-so, or no, we don't call, we'll text. We'll text so-and-so to make plans to go to the movies. That's that part of the brain, but that's not yet fully developed. And the focus a lot of times, therefore, is on the here and now. And because of that, adolescents may find it difficult to think and really conceive of tomorrow, right? Everything's more present-centered, and that can really intensify the significance of current emotions. So if something bad happens now, it's like everything, because just the brain hasn't developed to that point yet where forward or future thinking is happening. Third thing that you want to know is that puberty brings hormonal changes about, and they have physical and social impacts. And one of the things associated with the hormonal changes is that they contribute to higher emotionality and motivation to try new things and take risks. That's what we refer to as sensation seeking. So if you think about it, the stage of development, the kind of not quite maturity of the frontal lobes and the hormonal changes are a lot of factors that can kind of raise risk, that can make that stage of development just more challenging, a little bit more scary. And really it kind of implies that that's a time, a lot of times people say, oh, well, you know, kids are older now and this and that, and I don't have to be around, but you know what, you really do, because of all those factors. So that's just kind of backdrop, just things that you want to keep in mind in general. Now, turning to statistics in terms of adolescent suicide, like Melissa said, in Canada, suicide accounts for 24% of deaths among 15 to 24-year-olds. And according to the 2009 Statistics Canada, in the age group of 15 to 34-year-olds, suicide was the second leading cause of death, preceded only by accidents that were unintentional. So I think that's a pretty dramatic statistic. In terms of method, males tend to use more violent methods than females. Therefore, they have a higher rate of completion on the first attempt, and the most common method for males tends to be hanging, while the most common method for females is drug overdose. If there's any good news, sort of quotes, more young people think about suicide than attempt it, so that's good. And the attempts far outnumber the suicide completions. So the statistics tell us that 1 in 10 Ontario students in grades 7 through 12 reported seriously contemplating suicide, and there are an estimated 20 attempts for every completed suicide. So it's just something to think about. Now, suicide is associated with mental health problems, especially depression. And what we find is about 90% of child and adolescent suicide victims had a psychiatric diagnosis, and mood disorders and substance abuse were most common in adolescents who actually completed suicide. Importantly, the single most accurate predictor of a person's likelihood to attempt suicide is hopelessness. So that's important to know, because that's where people can intervene, right? If the most accurate predictor is hopelessness, you know, people around that person are very important to sort of shift that balance. Another very important point to raise is that suicide among gay and lesbian, bisexual, or transgendered youth, though that population of kids that are dealing with sexual identity issues have an increased risk for suicide. So the research tells us that 42% of youth in that population had thoughts of suicide at some point in time. 25% had thoughts of suicide in the past year that they were surveyed, and 48% said that the thoughts of suicide were clearly or to some degree related to their sexual orientation. And 54% of the attempts occurred before the parents knew of the youth's sexual orientation or preference. So again, that's very important to know, and it has a lot of implications, and it tells us how isolated those kids must feel. And of course, you think about things like, you know, bullying and lack of acceptance and so forth and so on when you look at those statistics. So that's just something probably that people may not be aware of, and it's really important to know. Okay, the next little bit, we're going to just be talking about risk and risk factors. So when we're talking about suicide risk, it's important to realize that risk can fluctuate. It's not a constant thing, so you can think of it like a dimmer switch on a light. Sometimes it can be less, sometimes it can be more. Different things can influence risk. And the factors that influence risk can be divided into two categories. Static factors, those are things that do not change. So for example, if you had a history of being abused as a child, that doesn't change. It's like a yes or no factor. Whereas there's dynamic factors, and those are things that can change and do change and are associated with context. So for example, substance abuse would be a dynamic factor. It could go up, it could go down. Whereas the other thing is just, it's there or it's not there. The other two concepts that you want to think about are triggers, and triggers are things that can increase risk. So it might be things like breaking up with a partner, loss of friends, any number of things. Could be a loss of a pet, anything that sort of just ramps things up and could be like, the straw that broke the camel's back kind of thing. And the other concept you want to think about is protective factors, and those are things that can reduce risk, such as having social support, having a mentor, having one person that you're really close to. There's many things that can help reduce risk, and that's what we call protective factors. So just keep those kind of ideas in mind as we're talking. So now we're going to just go through some different suicide risk indicators. So one major indicator of risk is preoccupation with death or suicide. So things like persistent thoughts of death or suicide, a plan to kill oneself, preparing for suicide or death, and also prior attempts. So those are, that's one risk indicator. Another risk indicator is psychiatric illness. So you may have psychiatric symptoms like insomnia, depression, anxiousness. You could be ruminating, having pervasive negative thoughts. Everything's horrible, gloomy, hopeless, that kind of thing. And also just having a psychiatric disorder, like a serious psychiatric disorder such as depression or bipolar disorder or schizophrenia, are also things that can increase your risk. Number 3, substance abuse. That's interesting. That, like as we said before, is a dynamic factor because it can go up or down. But substance abuse, and we're talking about things like alcohol, drugs, solvents, that's very important to think about because using those types of substances can magnify depression. And also we know that use of various substances lowers inhibition. So if it's magnifying depression and feelings of hopelessness and it's lowering inhibition, and you may have other triggers going on, that can be pretty dangerous. And again, I think in the tape it said, or Melissa might have said it, it's a permanent solution to a temporary problem. So if you think of it in that sense, or sometimes I say it's a tragedy of opportunity. So if the wrong factors congeal all at the right time. So that's something really important to realize about the substance abuse. Losses are a significant factor. Again, that's dynamic. That can change. It can go up, it can go down. For example, suicide of someone close to you or someone who you identify with, for example. Loss of a relationship, such as a breakup or a death, or sometimes it can even be things like, friends moving away, if you had only like one friend and that friend moves, for example. It can be things like perceived loss of worth, status, or acceptance, like in your social group. It can be changes in circumstances that result in loss, things like family breakup, being removed from your home, even financial stressors like bankruptcies, because that can create a lot of loss, in families. That can be a risk factor. Okay, things you also want to look out for are changes in functioning, such as withdrawal from others and withdrawal from activities. And I'm not talking about like one day here or there, but a kind of an ongoing pattern. Deteriorating routine and performance in school or recreation or chores. Excessive anger, irritability, aggression, changes in eating and sleeping patterns, increase or decrease in depressive symptoms, And just in general stress, amount of stress can also indicate something. The next one, victimization or abuse. Again, that would be a more static factor. That's a yes or a no. But if you've been maltreated, if you have a history of neglect or sexual, physical, emotional abuse, that will be a risk factor. Being exposed to domestic violence or being victimized by bullying or harassment. And then it's also important to know your family history. Is there a family history of suicide or various mental illnesses in a family, whether it's in the immediate family or even in the extended family, like uncles, aunts, grandparents, great-grandparents, because some of these disorders have a genetic component, so it makes you more susceptible, right? It increases your susceptibility or your predisposition, and then if you have other risk factors, it can then ramp it up. Or you may be more vulnerable to start with to some of the stresses that people go through. And then the last one, of course, lack of social support, like being isolated, being by yourself. That would also be a risk factor. Okay, warning signs that somebody might be thinking about suicide are things like talking or writing about death or dying, or sometimes we see even like pictures, kids, they're doodling, they're drawing pictures, and you can sometimes find like very odd and disturbing pictures, and it's like, ooh, like what is this all about? Statements like, no one cares, I wonder what it would be like if I'm gone, nobody would notice, I wish I wasn't here. Those kind of comments, they're cause for concern or things that you want to kind of look into a bit further. Giving away prized possessions like an iPod or a special piece of jewelry. Distancing yourself from others, being depressed more often than not, and sudden changes in behaviors or personality may be warning signs. Some of these things are kind of general, and they could be or they couldn't be, depending, but you have to sort of look at everything together and knowing your, the person that you're dealing with, and what's normal and what's not normal for them. I think the last thing I'm just going to talk about is common misconceptions. And people often think if they ask the adolescent if they're thinking about harming themselves, that somehow will make them do it. And that's not true. And the other common misconception is that talking about it is going to make it worse. And that's not true either. I think bringing it up, asking those questions comes as a relief a lot of times to that person, and it sort of opens the door, like it's out, okay, now you can talk about it, you can then take the steps to get the help. So, if you're not sure, it's better to ask than to not ask, and to talk than to not talk, because you don't want that person in their isolated state, right? And I think that's where I'm going to switch off with Charysse, and she's going to talk to you about protective factors and other things.